Story 1. Ambien caused me to sleepwalk. I fell, hit my head, and had a stroke. Story 2. When nothing else worked, my doctor prescribed trazodone for insomnia. It gave me a splitting headache, made me dizzy and foggy, and did nothing to help me sleep. Story 3. Topamax causes terrible short-term memory issues and brain fog. Story 4. I was prescribed Percocets once after surgery and instantly understood the pill epidemic. They would have consumed me. Story 5. Effexor helps anxiety symptoms, but withdrawal symptoms are severe. I am still trying to stop after 7 years. Story 6. The progesterone-only pill, also known as the mini pill, messed up my whole body. For example, I bled for 5 weeks straight. Story 7. Lexapro is apparently the gold standard for depression and anxiety, but it put me in a state of constant panic for months. I would wake up at 6 a.m. every morning with diarrhea and dry heaving, and I was scared to leave my apartment. I weighed 90 pounds. Buspirone was even worse and made me feel like I was having a heart attack. My resting heart rate went up to 132 beats per minute on that medication. I take Paxil now, and later I added mirtazapine, and the difference is night and day. I am a functional person again. My current psychiatrist is particularly annoyed that buspirone does not work for me, and when I told her about my reaction to Lexapro, she was in disbelief. Story 8. I have taken hydrocodone twice. Both times I was extremely nauseous and vomited within a minute or two. I will deal with the pain, thanks. Story 9. Benadryl gives me restless legs syndrome. It is a special hell when you are already sick. Story 10. Accutane worked like a magic pill, but those side effects at the time were severe. Story 11. Depo-Provera is a contraceptive for women. It caused a 100-pound weight gain and many mood swings. I worked with my therapist on hormonal mood issues. I am still trying to lose the weight. I am now taking semaglutide. Story 12. Sudafed and similar decongestants. Turns out I am one of those who cannot sleep while taking the drug. I once forgot several days of my life because I went a week without sleep due to Sudafed. Thanks to the friends who realized something was wrong and helped me stop taking it. Story 13. Topamax was the worst medication I have ever taken. I could not eat and slept constantly. Story 14. I started Zoloft in 1991. They said nothing about what would happen if I stopped. It was a nightmare. It did absolutely nothing for my panic attacks or depression, but the brain zaps and intense anger that followed missing a dose or quitting were brutal. Story 15. Prednisone. Evil. Wellbutrin. Equally evil. Story 16. Fluoxetine was the first antidepressant I tried. It helped massively at first. I started to feel like myself again. I could smile and make jokes. I ran out of medication because of my doctor's error and felt the most physically sick I have ever been. Nausea, brain zaps, mood swings, severe anxiety, no appetite, insomnia, alternating cold and hot sweats, and low mood. Around the 5th day, I attempted to take my own life. I was depressed, but attempting that was completely out of character for me. The withdrawal symptoms made me suicidal. The hospital gave me fluoxetine and I tapered off it properly. I was 18 at the time. I am now 26 and have not been suicidal since. It was definitely the sudden stopping of the medication that caused the extreme reaction. It was terrifying. If you are in immediate danger, call your local emergency number now. If you are in the United States, you can call or text 988 for the Suicide and Crisis Lifeline. Reach out to a trusted person or your healthcare provider for support. If you would like, I can help find crisis resources in your area. Story 17. Lamictal gave me Stevens-Johnson syndrome and nearly killed me. Add that to the top of the list. Story 18. Ritalin can cause hallucinations and a racing heartbeat. No, thank you. Story 19. I was prescribed gabapentin for nerve pain after shingles. I felt like I was tripping and stopped taking it after the first 2 days. Story 20. I will not take propranolol again because I nearly fainted while taking it. The experience frightened me. Story 21. Valium. I was prescribed a pill to help me get blood drawn because I have issues with needles. However, it made me even more panicky than I would have been if I had not taken it. Story 22. I took Plan B. It made my head spin, caused severe pain, and I was very nauseous. I bled for an entire week, and now it may not have worked because my period is a week late. I will take a test in the morning. Wish me luck. Update. The test was negative. This was my first ever pregnancy scare, so I am going to keep taking tests until either one is positive or I get my period. Thanks for the encouraging words. Story 23. Seroquel made me eat more than I thought possible, but I was rarely awake. I fell asleep watching TV at friends' houses, at work, and while driving. Then they added Abilify, which somehow made it even worse. I did not try medications again for a few years. Story 24. Amitriptyline caused auditory hallucinations. It was a wild ride I have no desire to repeat. What bothers me most to this day is that I never questioned where the voices came from. It showed me how your own brain can seriously harm you. Story 25. I took a selective serotonin reuptake inhibitor medication, sertraline, for nearly 10 years to combat depression, but it never really helped and everything in life became less meaningful. I reached the point where I did not care about anything anymore, so I stopped taking it, only to realize the emptiness and depression had been caused by the medication. Life has been absolutely fantastic since I stopped, and other than the occasional existential crisis as I realize I have wasted some of the best years of my life, I have not had even a hint of depressive thoughts. Story 26. I was put on Seroquel, an antipsychotic, even though I had depression and insomnia. I do not know why the hospital thought that was a good idea. They started me on 75 milligrams of Seroquel and kept me on it for 7 years without supervision. Eventually, enough doctors commented on the long-term use that I had to taper off it with my general practitioner. It took 3 months of very difficult withdrawal before I could regularly get about 5 hours of sleep a night. I later found out I am autistic and having meltdowns, not panic attacks. Story 27. Sumatriptan for migraines. The side effects can mimic or even trigger a heart attack. The jaw ache, difficulty breathing, and severe, nauseating chest pain are absolutely no joke. Story 28. I will never take clonidine prescribed for insomnia again. Story 29. I took Lyrica for pain. After 4 years on the lowest dose I did well, but in the 5th year my memory failed and my attention span declined. I used to read 4 to 5 books a week. Now I struggle to read 1 book a month. Story 30. Morphine. I broke out in a rash and had to go to the hospital because it burned my skin. Story 31. Venlafaxine. Worst medication I have ever tried. Treatment-resistant drug. My fucking ass. It made me so anxious, and when I ran out of medication, the withdrawal effects were so severe they put me in a crisis. Promethazine as well. Story 32. Topamax. I could not draw a clock. I was stupid. The soda was flat. Story 33. I hope I won't need any more surgery or opioid painkillers afterward, because the painkillers completely disrupted my bowel function and I couldn't have a bowel movement for days. It was horrible. Story 34. I'm going to say Ambien. I didn't have any side effects from it, but I became addicted and soon started abusing it, sometimes taking 3 to 4 times the prescribed dose. Thankfully, I woke up fine the next morning, dumped the rest of the pills, and went back to the doctor and told them to never give it to me again. That night was the wake-up call I needed. It made me realize I had a problem and led me to a fully sober life. Story 35. That fat blocker that caused you to soil your pants for 2 weeks with an oily discharge. Story 36. Venlafaxine. I did not care what it helped. I accidentally missed 1 dose and knew immediately I could not stay on it long term. Story 37. Doxycycline caused significant side effects. I'm not normally sensitive to antibiotics, but it made me nauseous and caused esophagitis that I had to treat for 2 months afterward. Story 38. After my first breast augmentation, they gave me fentanyl and I became very sick. I thought I was going to die. At the second surgery to replace the implants, I informed the team about my reaction, so they did not give me fentanyl, and I walked out 1 hour after surgery perfectly fine. I cannot imagine people using fentanyl for recreation. Story 39. Every time I go to a new psychiatrist, they mention Abilify, saying my symptoms are perfect for it. But it literally de-aged me. My mental age is now about 12. Story 40. Compazine prochlorperazine. I was given it intravenously in the emergency room for a migraine. I felt extreme inner restlessness and wanted to crawl out of my skin and die for weeks without relief. I took diphenhydramine and diazepam and neither helped. It is now listed as an allergy. Akathisia is a movement disorder characterized by extreme inner restlessness and an inability to stay still. It is most often a side effect of medications, particularly antipsychotics, and can cause pacing, rocking, and fidgeting. Sufferers may experience severe distress, anxiety, and an inability to remain in one place. In severe cases, it can lead to suicide. Story 41. Risperdal sent me into psychosis and caused paranoid delusions. Story 42. After taking Abilify, half of my hair fell out and I thought I was having a stroke because I experienced double vision. Story 43. Adderall caused hallucinations and flashes in my vision. A selective serotonin reuptake inhibitor at a low starting dose caused severe serotonin syndrome, and I was advised never to take selective serotonin reuptake inhibitors again. Story 44. Trintellix made my anxiety 10 times worse. I became emotionally unstable, crying unexpectedly, often angry, and exhausted 24 hours a day, 7 days a week. It lasted 5 months of absolute hell. Story 45. Prozac and Latuda. Both made me want to end my life. Seroquel made me pass out 15 minutes after taking it, and I involuntarily slept for 14 hours every day. It made life harder because I was not sleeping. I was 18 and a working college student. I needed to be awake. Klonopin did the same. I was 18, having a major panic attack, and a friend gave me one, which was a huge mistake. I lost the next 18 hours. One moment I was in the kitchen, then I woke up the next morning with my grandmother calling to ask if I had gotten new tires for my car yet. Also, make sure your provider diagnosed you correctly. All these psychiatric medications were for a disorder I do not have because no one listened to me. This could have been avoided. Story 46. Olanzapine was prescribed to me once, off-label, as a sleep aid. I slept about 16 to 18 hours, but when I woke up I felt awful. I had the unpleasant experience of feeling as if I were watching my own life on television in black and white. I felt robotic. I had never been so profoundly affected by a drug before or since. I only took it that one time and discarded the rest immediately. The most surprising part was how small the dose was. I was looking at the tiny pill thinking this would not do anything. I was worried about accidentally inhaling it, laughing out loud. Story 47. Topamax. That medication was terrible. I think I may have developed psychosis from it. Story 48. I cannot remember the name off the top of my head, but it was prescribed for depression. It affected my digestion, and the only effect on my mind was a feeling of fuzziness. Story 49. Prozac gave me really bad rage. I was angry all the time. Story 50. Lexapro masked my anxiety very well, but it caused me to pass out. I almost passed out on the street twice, so I threw it in the trash. Rivotril made me feel like I was losing my mind. It is the worst medication I have ever taken, and I never want to take it again. Story 51. Loratadine does not help my hay fever and causes nosebleeds. To be honest, I gave up on non-drowsy medications and tried a sedating antihistamine, which worked much better without causing drowsiness. Story 52. Gabapentin. I have degenerative disc disease, so pain is a way of life. The doctor tried it on me to get me through until my surgery. After one dose, I felt homicidal and suicidal. I called the office immediately, and they told me to stop taking it. That medication seriously affected my brain. Story 53. I had brain zaps for 6 months after I stopped taking Cymbalta. It was absolutely awful. Story 54. I had an amazing relationship before I started taking Lexapro. I moved away and maintained a relatively short-distance, long-distance relationship. I became severely depressed, started taking Lexapro, and felt nothing for the better part of 6 months. I felt no love, happiness, sadness, or anger. It numbed my emotions and reduced my sex drive, and it probably destroyed the best relationship I had. It was partially my fault and partially hers, but Lexapro was the domino that triggered everything. We had distance issues for months. Yet Lexapro blunted every emotion and made me distant and cold. I was not cruel or mean, but I could not feel anything. The best decision I ever made was quitting Lexapro. I probably would not be here if I had not. Story 55. Ciprofloxacin damaged my shoulder tendons. It was the worst antibiotic I have taken. Read all side effects before taking any medications. Story 56. Accutane was prescribed for my acne when I was a teenager. It made my lips so dry that they would crack and bleed when I smiled. Story 57. After starting monoamine oxidase inhibitors, I became an insomniac. I would stay awake all night and finally sleep around 8 in the morning, then wake up around noon. I was afraid of everything and very moody, and my body jerked frequently. I knew I was falling asleep because I would begin full body twitching. Story 58. Gabapentin. I was given it to help with pain from nerve damage. I learned it is also a psychiatric medication, and it makes me act like an unpleasant person. Story 59. I don't think I have ADHD, but I was prescribed methylphenidate a few years ago. I took it for about a month and developed severe anger issues that I had never had before. I screamed and cried at my parents after they agreed to wait 45 minutes at a restaurant. I stopped the medication cold turkey, along with my other medications propranolol and Prozac, and never took them again. Story 60. Citalopram gave me serotonin syndrome, and I don't remember roughly 6 months of that year when I was taking it. I still have side effects and am rebuilding myself, apologizing for how it made me act and trying to be accountable. Story 61. Metoclopramide, also known as Reglan, is an antiemetic. I had no idea what akathisia was, but when they gave me Reglan to curb the vomiting from dilaudid for a kidney stone, I became so restless I wanted to crawl out of my skin. I felt panicked and nearly pulled the intravenous line out and ran because of the agitation. If you must receive it intravenously, ask for a slow intravenous push and diphenhydramine or another anticholinergic with it. The first nurse who gave me metoclopramide did not take my reaction seriously, but the next nurse saw me upset and gave me 2 doses of diphenhydramine to counter the restlessness. Calmed me completely. I was able to be discharged and then slept for 18 hours. I was very grateful to that nurse. Story 62. Prednisone made my heart race and made me lightheaded. I thought I was going to pass out at the grocery store. Story 63. Metformin sent me into lactic acidosis for 3 days. My feet and hands became ice cold. My vision was blurry. I was slurring my words, and I could barely move. I crawled to the bathroom. The prescribing doctor laughed, did not believe me, and told me to go back on it. Another doctor I trusted warned that if I ever took it again I could die. I stopped seeing the first doctor. Story 64. They say Lexapro is not habit-forming, but it is. Getting off it is terrible. Story 65. Methotrexate. My arthritis is debilitating, but I would rather have it. Story 66. Prednisone caused moon face and severe water retention. Story 67. Montelukast caused severe, terrifying sleep-related issues. I had walking pneumonia and was given this medication by the emergency room. I strongly advise against using it. Story 68. Mirtazapine, an antidepressant, caused me to gain so much weight that I am still trying to lose it almost 10 years later. Ironically, it made me more depressed because of the weight gain. Story 69. I do not take most of my attention deficit hyperactivity disorder medications. I only take 5 milligrams of Adderall now if I absolutely need it. Usually I don't. Story 70. I would prefer never to take hydrocodone again if I can avoid it. I was prescribed it after the removal of my wisdom teeth and it made me extremely itchy. I was completely doped up and could only lie there writhing with itchiness, trying to sleep until I could stop taking it. I lasted about 2 days before I could not take it anymore and switched to the high-strength ibuprofen they had also prescribed. Story 71. Doxycycline and other antibiotics in that family increased my cerebrospinal fluid production. I became paralyzed from the neck upward because there was so much fluid around my brain. I stopped eating. Doctors thought I had meningitis. They performed a lumbar puncture. Cerebrospinal fluid is supposed to drip out, but mine shot out, which helped release the pressure. Story 72. Metformin. I have never been so sick, with inflammation throughout my body. Story 73. Compazine causes akathisia, a feeling of intense restlessness with a constant urge to move that can be mistaken for anxiety. Feels awful, like losing my mind. I get severe nausea after surgery and from motion sickness, and compazine is used to treat nausea. Story 74. Gabapentin. I had a doctor taking major kickbacks from the pharmaceutical company that made it. He prescribed an obscene number of pills at a ridiculously high dose, which caused a full psychotic break and left me with worse neuropathy than the condition it was intended to treat. That doctor blamed me for my fragile mindset and still tried to push that drug on me. Months after I left his practice, he mailed me 8 bottles of gabapentin, 600 pills each, even though his office had never once sent my medications by mail before. Story 75. I wish I could remember the name, but I was 12 and had an unknown infection, so they gave me a pill that killed all the bacteria, good and bad, in my body. It was the craziest sensation. Almost immediately I felt like I had lost 15 pounds. Story 76. Levaquin. Both times I have taken it, I ended up with tendon issues so severe they required months of physical therapy to heal. Never again. Story 77. Omeprazole caused symptoms of early-onset dementia when I was in my 50s. The symptoms disappeared within a week after I stopped taking it. I worry about people in nursing homes whose medications are changed and whose symptoms are written off as due solely to aging. Story 78. Rexulti is a difficult drug to stop. Even after tapering, I experienced severe withdrawal symptoms for more than a month. Story 79. Hydromorphone. It is the most common painkiller. They prefer it to morphine. When it was given to me, I could not urinate at all and had to have a catheter inserted. It was the worst. Never again. Story 80. Antiemetics or anti-sickness tablets, especially those that were previously classified as antipsychotics, made my muscles cramp severely. Story 81. I was on Jardiance for 8 years. I had a knee replacement and could not recover in 10 months. 2 orthopedic surgeons could not figure out what was going on. Just by luck or chance, in August I had a prescription for a toe fungus. 3 pills once a week for 4 weeks. The pharmacist told me to stop Jardiance for 4 days because of a possible interaction. I woke up the next morning and my knee pain was 50% gone. I was stiff but without pain. In fact, muscle and joint pain everywhere was noticeably lessened, and I kept improving every day. A rare side effect of Jardiance is joint and muscle pain. I felt the difference quickly because the half-life of Jardiance is 12 to 17 hours. I had been on it so long I did not notice how overall achy I had been, and the knee pain from the replacement was relentless. I got so used to it that I did not realize how much pain I was in until it stopped. Story 82. Ambien helped me sleep well, but it caused depression. I felt doomed. Story 83. Levaquin. I could not even keep water down until it was out of my system. Story 84. Azithromycin Z-Pak. I am allergic. I had unbearable hives for weeks. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.